Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists nurse practitioners with employment contract and independent contractor agreement issues. Today I'm going to talk about nurse practitioner compensation and productivity review. So when I am approached by an NP and they want me to review their contract, obviously we're going to go over the compensation pretty thoroughly and just I'm going to talk about some of the different types of models that are used for nurse practitioners, and then some things to think about as far as making certain that you're keeping all of the money that you deserve. First, the most common way a nurse practitioner is compensated is just a straight base salary. Very simple. They're going to pay you $120,000 annually. You do your work, and that's it. So not much to talk about when it's a straight base salary. It's very simple. When it complicates things would be if you have productivity bonuses, and then the differences between private practice and hospital-based employment are important as well. So let's just talk bonuses first. If you're working in private practice, a bonus 99% of the time is going to be based upon collections, meaning how much you personally bring into the practice. Occasionally you'll see encounters, so meaning they want you to see X amount of patients per day. If you see above that amount, they'll give you a set amount of dollars for every patient above that amount. And that could be daily, it could be weekly, it could be monthly, quarterly. It just depends how the employer wants to do it. Now, how a collections-based agreement would work is if it was just a bonus, they would usually set a threshold. Many times it's just whatever they paid out to you via your base salary, and then any money above that the practice collected on your behalf, you would get a percentage of that, maybe somewhere between 15 to 25%. Now, there are some practices that will pay you exclusively through a percentage of collections. And in that scenario, somewhere between 35 to 40% would be a normal percentage of collections for a nurse practitioner. Now, this is a big red flag area that I want you to be aware of. If you're paid purely on collections, and many times they'll start off at like a guaranteed base amount, or maybe a daily rate or something like that. So there will be some period of time where you'll have a guaranteed amount and then transition in collections. If you have a contract where you're paid purely on collections, you want to make absolutely certain that there's language in the contract that states you're going to get credit for any of the collections that come in after the contract is terminated. And let me give you a few examples. If you're in a heavy private insurance-based practice, an accounts receivable cycle, I'm just going to throw out a number here, it could be 30 days. And so if you give notice, and for most NPs it'd be somewhere between 60 to 90 days, for the last month that you're working there, none of that money that you've been producing is going to be collected till after you're gone. And so you want to make certain that there's language in the contract that says either you'll receive credit for all of the money the practice receives after you're gone. Most of them will put a window on it. I would say no less than 90 days, because what you don't want to do is work out the last 30 days of the practice and then essentially work for free and not get your standard collections percentage of all of that money that comes in after you're gone. So make certain there's not language that says you get no compensation after the date of termination, and make certain there is language that says you'll get credit for any collections that are received after you're gone. So that's a little bit about private practice. Now, if you're in a hospital, once again, a base salary is easily the most common way to compensate a nurse practitioner. RVUs are used instead of collections in a hospital or healthcare network environment. Perhaps you'd have an RVU bonus, and how that would work, they would say you're expected to produce 1,000 RVUs a quarter, and then any RVU produced over that amount, you would get a set dollar amount per RVU. That's a normal productivity bonus. Some places will compensate entirely based upon your RVU production. And once again, you'll usually have a guaranteed period of a year to 2 years, and then it could shift to the RVU model where you'll get a base draw. So they'll set like an amount that you still get paid every paycheck, and then usually every month they would do a reconciliation, and if you achieved whatever threshold they set, then you would get paid a bonus after every month or quarter, something like that. So those are some things to think about when it comes to compensation and productivity for a nurse practitioner. If you have any questions about an employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.